Oh, Mark, you're back.
Hello.
Man,
How are you, doctor?
good, man. How are you?
I'm back.
How was your day today?
What has been busy, man?
Man, I
Oh,
know.
but I have issues, man.
Hmm.
I was depressed the whole week.
Why, man? Sorry about that.
I have a patient.
Hmm.
He has a septic wound.
Oh.
His wound is big, and they have been managing him previously from the other ward.
Hmm.
We have been giving him several antibiotics,
Hmm.
but he's not responding.
Oh, man, sorry about that.
Clinically, he's not responding.
Have you guys done like culture and sensitivity for his
Culture,
wound?
yeah.
Hmm.
Actually, that's why even at least we have got a solution for him.
Hmm.
First of all, we have been managing him on gentamicin,
Hmm.
amoxiclav.
Hmm.
We gave ciprofloxacin.
Hmm.
We give
With no
levofloxacin
response.
without response. Pisa, ceftriaxone, good brands until we did the culture.
Hmm.
Our culture, it came out actually yesterday. I received the results
Hmm.
with a lot of insensitivity, like all drugs we have been giving.
Resistance.
Yeah, there's resistance. Actually, about 10 drugs,
Man.
and only one
Mm.
selected drug, meropenem.
So
Which
it's only
one?
sensitive to meropenem
Only.
and it's expensive.
Very expensive. So, doctor,
Mhm.
don't you think other people outside have similar problems like my case of the
Man,
drug misuse, especially antibiotics?
man. These days the thing of antimicrobial resistance is very common. It's very common. I think it's because people are
It's now
misusing
becoming a
antibiotics.
global problem.
Yes.
Cause it is a big challenge actually managing our patients.
Man, these days, you know what happens? Each person feels like they can self-medicate. Somebody feels a simple flu, they self-medicate. People take medicines, they don't finish their doses.
So how do you think we can help them? Don't you think they need some serious explanation or some clue or an advice, really? Because
Actually,
I was stranded
mm,
the whole week managing this guy, really.
man, managing a patient who has antimicrobial resistance is very hard.
Very.
Because each antibiotic you try to give, the body has already developed resistance against it. So it becomes challenging to treat them. And remember, like for any surgical procedures to be done, at least they have to give you some antibiotics for prophylaxis, or even after surgery, the post-op care, antibiotics are needed. Even in cancer, even all diseases, most of them, sometimes we need antibiotics to manage them. However, if you find that your patient has already developed antimicrobial resistance,
Yes.
an antibiotic that you give them will not work for them. And that means that our life is in danger. So we need to educate our public.
Yeah, what do you think they need to do, by the way?
One, let's stop self-medicating, at least for diseases which require antibiotics.
They get than them getting anyhow.
Exactly.
drugs.
When you feel sick, at least better visit a doctor. They'll make a prescription. They'll decide if you need an antibiotic or not.
Okay.
And then they'll give you an antibiotic if you need
Good,
it.
at least.
And we need to educate our people, and people should stop underdosing themselves. You can prescribe for a patient to take a medicine maybe for 10 days. They will take for 2-3 days, they feel better, and then they will just withdraw.
Oh, because they feel like they are now fine.
Exactly.
They don't know that they have to complete the dose.
Exactly.
That's a good point.
People should really finish their doses. Don't take your spouse or your partner's or your child or your parents' drugs. Some people, because mama the other time was sick and took a certain drug and improved, even for you when you feel sick, you do the same. Maybe like mama, the other treatment you took the other time, you get that, and So our people should stop doing that.
And don't you think, like there's someone there who even doesn't know what we are discussing about? How would you, in a simple term, how would you really explain someone that this is what we call antimicrobial resistance?
So basically, it starts from the word antimicrobial.
Yeah, because they need to understand really, then they can pick up from there.
First of all, the microbial is something like germs, small germs. These can be a lot of things, bacteria, viruses, and fungi. So these, much as some of them are useful to our bodies, but some of them are dangerous.
Yeah.
Those ones which are dangerous, we treat them with antibiotics. So if a patient gets a disease and maybe doesn't take an appropriate antibiotic, or they take and they don't finish their doses, some of these microbial, these germs can detect that hey, there are some enemies who are coming, so they prepare themselves. So next time you get this illness which needs this antibiotic, by the time you take the antibiotic, the microbes are already resistant. They have already developed protection against it.
Because they sensed it already before.
Exactly. So now what happens? For any antibiotic that you're given, it will not work on you, and that really puts the whole of our lives in danger.
That's the point I wanted them to really get clear about that
And
issue.
Dr. James, the other thing, people these days tend to use antibiotics for animals.
Oh yeah, yes, actually, tetracycline. I've ever seen tetracycline
people
for
should stop
animals.
that. Because if you give your birds or an antibiotic, yes, it will have some impact on the birds, but this antibiotic is going to stay in the flesh of this
Even
animal.
milky.
Now, when we consume it, we get those small doses, and they can cause antibiotic resistance. So I feel like
it shouldn't be on human, but also on animals, because we can equally eat their meat or drink their milk. And we really consume it as
Dr.
well.
James, I have to go. Man, I hope you guys take care of that patient.
I think I need to go back.
Sawa, man. And give the best care to your patient, man.
Okay.
And educate your public, man.
No problem then. Let me also go.